Good afternoon, and thank you for listening again today. As of 2 p.m. today, there have been 4,388 positive cases of COVID-19 in Missouri, including 114 deaths. Approximately 46,000 Missourians have been tested at this time. Last week, we announced plans to move forward with our first alternative care site in the St. Louis region. And I'm happy to report that project has been completed and will be available to accept patients starting tomorrow if needed. Working alongside the United States Army Corps of Engineers and many partners in state government pulled together in this effort, including the Missouri National Guard. We are very thankful for their hard work and coordination to convert this facility in such a short amount of time, giving us more flexibility in our COVID-19 response. Today, Director Carson is here to give us an update on that. Director Carson?
Thank you, Governor Parson, and good afternoon, everyone. Last month, a joint federal-state team was assigned the mission of assessing locations around the state that could be converted into healthcare facilities in case our Missouri hospitals became overwhelmed with coronavirus patients. The team, led by the National Guard on the state side, scouted convention centers, arenas, and hotels. The plan was to have options that could best fit our needs based on how widely the pandemic spread. The decision was made to convert a hotel in the St. Louis area, so if necessary, it would be capable of serving more than 100 COVID-19 patients with mild or no symptoms. This was to free up hospital beds if necessary. We're happy to announce, as of today, a Quality Inn hotel in Florissant has been converted and could accept medically referred COVID patients if necessary. This is our first project of this type in Missouri. The governor and I and our whole team want to thank all the partners in this tremendous expedited process for all their work and their patience. As the governor said, we are facing an unprecedented challenge, and this was an unprecedented rapid response to support our medical personnel and potentially save lives. Our dedicated team includes the Department of Public Safety, the Missouri National Guard, the State Emergency Management Agency, the Missouri Department of Health and Senior Services, the Office of Administration, the Missouri Hospital Association, FEMA, the U.S. Army Corps of Engineers, and the U.S. Department of Health and Human Services, and the lead contractor, Tarleton Corporation of St. Louis. The Missouri National Guard's 635th Forward Engineer Support Team led our state effort. The Guard's 139th Air Wing and SEMA's Disaster Medical Assistance Team are providing the medical staffing for this facility. Right now, because Missourians have embraced social distancing and helped flatten the curve of the COVID-19 cases, the Florissant alternate care site will remain ready to receive patients if needed. We're grateful for the work of our partners who got it built and those who are ready to staff it medically. We're also appreciative of the Florissant PD, as well as the City Mayor of Florissant, Tim Lowry, for their patience during this tremendous situation. Also want to update you on PPE. As you know, there continues to be tremendous demand for masks, gowns, gloves, face shields, and other protective equipment for our medical personnel and our first responders. We are continuing to pursue PPE. Yesterday, SEMA took delivery of full-body protective suits. But this afternoon, SEMA sent out a recall notice to our local law enforcement and fire service partners across the state. SEMA is recalling 48,000 KN95 masks that went out to our first responders on April 2nd and April 8th. Testing over the weekend by the Missouri Department of Health and Senior Services showed that some of these masks did not meet standards. So again, SEMA is recalling 48,000 KN95 masks. We've asked our local response partners to immediately pull those masks out of circulation and to make sure they are not used. and SEMA will be collecting those masks to ensure they are not used. I want to say a special thanks to all of our state employees and our response partners around the state for the commitment throughout this pandemic response. I was amazed to see their dedication yesterday on Easter Sunday. They continued to work, and the citizens of this state can be confident that we're all working for you for as long as it takes. Thank you.
Thank you, Director Karsten, for that update. And again, I can't tell you how proud I am of the Missouri National Guard and their members, and for everyone that helped to be able to put a hospital in place in just a short period of time to help with the COVID-19 crisis. Some incredible people out there working together every day trying to get through this crisis on that. As we continue to combat COVID-19, we are in constant communication with doctors and hospitals across the state. From converting ICU beds to training healthcare personnel and establishing remote testing sites, our hospitals and healthcare workers have responded to COVID-19 without hesitation. They have been working 24/7 on the front lines of this crisis, risking their own health to care for fellow Missourians. We cannot thank them enough for their hard work and dedication, especially right now. We have excellent healthcare systems, and I am extremely confident and proud of our hospitals as we continue to fight COVID-19. Today, Missouri Hospital Association President and CEO Herb Kuhn is here to talk more about key actions taken by hospitals across the state. Herb?
Thank you, Governor, and good afternoon. Before I move to my formal remarks, I want to just make a couple of observations here. One is, I really want to thank the Governor and his team on a number of different fronts of actions they've taken. First, just the multi-agency public-private response they've put together and organized. Hospitals are complicated organizations, and their efforts to touch so many different state agencies, the Governor has brought them together, speaking with one voice, to help us move forward, and I think in a very effective way. The second issue is nimbleness. Now, you wouldn't think that you would hear the term nimbleness and government in the same sentence, but it's true. This administration has been extremely nimble, particularly when it comes to state waivers. We've requested well over 70 federal and state waivers, and oftentimes we submit those in the morning, and they're approved by the afternoon. That is an incredible quick turnaround, and it's much needed for us to continue to reconfigure hospitals to address this current epidemic that's out there, and we appreciate that nimbleness. And then finally is communication. This administration has been extremely open to communication with us. The Governor meets with every hospital in the state on a weekly call. It's a chance for he and his team to share with us on things that are going on with activities they have going on, but a chance for hospitals across the state to engage with the Governor, talk about problems they're seeing, and ultimately get those solved. So we thank you on all those fronts. It's made a big difference for us. So now let me talk about three kind of general areas. I want to start a little bit about preparedness. I want to talk about some of the changes that you're seeing in hospitals right now, and talk about a couple of storm clouds on the horizon, some challenges that we have getting ready to go forward. So first about preparedness. Since 2002, the Missouri Hospital Association, under contract with the state, has actively engaged in the Federal Hospital Preparedness Program. Originally focused on just acquiring equipment and supplies, the program has changed over the last couple of years to really talk about regional healthcare coalitions. And I think it's this effort to establish these regional healthcare coalitions that has made us much better and much stronger to deal with this pandemic, because it's created a lot of training opportunities over the last several years, which are serving us well right now. And as a result of that, hospitals working together, working with local officials, with state officials, and ultimately the federal government, have been able to move and coordinate a number of activities. Supplies have been deployed, and data needs, through a system we stood up nearly 2 decades ago, have really been effective in terms of helping us understand where there are challenges, where there's opportunities, and as you heard from Director Karsten, the establishment of this new site in St. Louis. All of that has helped us prepare for the state surge as we go forward. Also important is the mutual aid agreement. The mutual aid agreement was first established in 2007 in this state, And it's an agreement that permits hospitals to be able to move people and supplies to areas where someone is at capacity or near capacity as we move forward. And so to give you an example of what that's like, think back to 2010 and the tornado in Joplin. If you remember, one of the hospitals in Joplin was totally destroyed and the other was damaged, but it was still functional. And there were a lot of injuries in Joplin at that time. But through a mutual aid agreement, we, along with others, were able to move people, supplies, and other services that they needed down there to deal with the many injuries that were in Joplin. This agreement, this mutual aid agreement that we have here, allows us to establish that same kind of system. Now, originally, when the coronavirus reached the shores of this country, a lot of folks thought that it would attack the country evenly as we went forward, and whether a mutual aid agreement would be very effective for us. But what we've seen is the coronavirus is acting more like the flu. And as a result, this mutual aid agreement, as it moves from community to community, will be very, very helpful for us to deal with issues if we need them. Now, fortunately, we have not had to do any deployments under this agreement, but we are ready and we have the tools in place to deal with that if it happens. So preparedness has been a key part of this effort, and we thank this administration for helping us continue to get prepared in that arena. The second thing I want to touch on is kind of what's going on now in terms of hospitals. And they're busy reconfiguring their operations to make sure we can meet the current demand, prepare for the surge, but also importantly, to be there as we move through this entire cycle until a vaccine is prepared and fully deployed that's out there. So key actions you've seen taken by Missouri hospitals is a lot of training for healthcare personnel, as you heard the governor talk about, how to identify infection, how to safely collect a specimen, and how to effectively report information once you have a positive case to local, state, and federal officials. Once patients are identified, and even those patients that are under investigation before we know whether they have the disease or not, immediate action is taken within hospitals to put those folks in isolation. A lot of efforts going on transmission precautions, protective equipment for workers and patients. And again, I want to give a shout out to the governor and his team. They have moved heaven and earth to try to find personal protective equipment, or PPE, for everybody who needs it in this state, whether it's the frontline workers in hospitals, whether it's emergency response personnel or other healthcare workers. They've done everything that they can. And you just heard from Director Karsten talk about the fact that they've identified even faulty or counterfeit products and able to recall those immediately to make sure people are safe out there. But also the transmission precautions go beyond the protective equipment. It's monitoring personnel in hospitals in case of exposure. And it's care for patients in the hospital as they move them once they find out that they're positive that's out there. Also, infection control programs are in full use in hospitals. Lots of work to make sure that disinfection of surfaces and equipment throughout the facility is ongoing. And then finally, visitor access. To bend the curve, to be able to stop the transmission, we had to limit access to visitors in hospitals. And this is a hard one to do. But one thing that we can think about the personnel, and the governor talked about the personnel that are working in these facilities, whether it's the doctors, the nurses, the chaplains, others, are making sure that those families are able to connect with their loved ones that are in the hospital that might be COVID-19, or that new mother that might be having their first child and the family can't be around them. These hospital staff are doing everything they can to make sure during this time of separation, these families can come together. But in addition to kind of what's going on inside the hospitals, you see hospitals busy reconfiguring themselves to meet new capacity needs. Building capacity and to support the surge, we've converted or added more than 1,000 intensive care beds in the state of Missouri. We've established remote testing sites to protect the public and healthcare workers. We're constantly tracking hospital capacity and PPE supplies, and as mentioned before, coordination with each other, local, state, and federal officials, I think is making our response much more effective here in the state of Missouri. But there are challenges, and let me just talk briefly about those. What's amazing about hospitals and healthcare workers is their resiliency. Anyone who's there 24 hours a day, 7 days a week, 365 days a year to care for all of us is an amazing group of people. Their motto, always there, ready to care, is something we all are glad they live by, and especially now. But that resilience is being tested in ways we've never seen before. Yes, it's part of this unknown, this unseen virus that's traveling around the globe. But it's also the financial strain that's being put on our economy as a whole, but especially with hospitals. As the virus hit the U.S., what you saw immediately was hospitals all across this country and in Missouri stopped doing elective procedures. This was done to protect staff and to protect the public, but also it was done to preserve critical PPE supplies. But that move has taken a toll. We currently estimate that Missouri hospital revenues are off by more than 50%. This amount is pegged at $32 million a day, nearly $1 billion a month. And it's all in the face of trying to maintain 24-hour operations and also the additional expense of preparing for the surge. This issue has also been extremely problematic for rural hospitals across the state. Now, both the federal and the state government have recognized this, and they're moving to provide assistance. The recently enacted Federal CARES Act included many things, but also a $100 billion fund to help healthcare providers. And last Friday, the first payment, $30 billion from that fund, was made. Of that $30 billion, approximately $618 million came to the state of Missouri to support 5,252 healthcare workers or organizations in the state. Of that $30 billion, hospitals received about half. But with our current decline in revenues, it only sustains us for about 10 days. So to help manage this, and again, I salute the governor and his team for this, they've joined with us to create a financial task force to help us monitor the liquidity challenges of hospitals and to look at every federal and state program we can support and use to provide sustainability. We look forward to beginning this engagement with the state on this urgent effort. But importantly, as this crisis hit, you see kind of the spirit of the state of other organizations coming to the aid to understand what's going on. Immediately, we heard from the Missouri Farm Bureau, and the Missouri Bankers Association reached out to us to talk about the financial sustainability and what they could do to help. They too recognize the importance of their local hospitals for the daily care they provide, for their role during this pandemic, and the fact that they are the largest employer in many communities across the state. In fact, of the 10 largest employers in the state of Missouri, 4 are hospital and healthcare systems. So our partners, the Farm Bureau and the Bankers Association, are also important members of this task force, and we're thankful for this engagement. So finally, let me just say I am so grateful to Governor Parson and his leadership on the full suite of coronavirus issues, including this one on financial issues I just discussed. The coronavirus experience reminds us of the indispensable need for hospitals, for communities, and for this state of Missouri, and we're grateful for all the help and the support that we are getting. Thank you.
Herb, thank you very much. Thank you for what the hospitals do in this state, and more importantly, thanks for what those frontline people has done out there during this virus. I can't tell you, from early on when the coronavirus, this crisis hit, we were in constant communications with the hospital, and one of the things we all knew early on, that we were on our own. We knew we was going to have to do what it takes to protect Missourians here in Missouri. And regardless whether it was from my office or from the hospitals around this state, there wasn't going to nobody come in and rescue us. We realized that we had to buckle down and figure out a way to solution to help the people of this state. And the hospitals around the state, the employees that work in those hospitals, got the job done and are continuing to do the job every day. We wasn't talking about money. We wasn't talking about finances. We was talking about saving people's lives and treating people in this state. And I'm so proud of the people out there that served in that capacity and the hospitals around the state for what they've done to help us with that and will continue to do to help with this crisis. While the number of COVID-19 cases rise, I want to remind Missourians that each day people are also recovering every day. To help current COVID-19 patients, the Department of Health and Senior Services encouraging those who are fully recovered from COVID-19 to donate plasma. And today, Dr. Williams is here to provide some details on that very cause. Dr. Williams.
Thank you, Governor, and thank you, Herb. I was at a forum about a week ago, a virtual forum, and one of the call-in guests said, I've had COVID-19, is there any way I could help other Missourians? And to me, he is the exemplar of the spirit the governor talks about. Based on that conversation and working with some of our colleagues, the governor and I talk with infectious disease specialists every week. We're announcing today that we are starting a convalescent plasma program in which if you've had COVID-19 and you're over 18 and you're not pregnant and you've recovered for 14 days, that you can donate your plasma. If you'll go to our website, it will show you the links. There are several institutions around the state, our academic institutions, who've taken that upon themselves to do that. And again, this gentleman was fortunate to have a mild disease, but the plasma with the antibodies he has will be used to help people who are severely ill. So we're incredibly appreciative to that Missourian and to all Missourians for that kind of spirit. Thank you.
I also want to thank Dr. Williams for what he's done for the state. I remember calling him when this first outbreak came to the state of Missouri. It seems like a long time ago, but about a month ago. He was actually seeing his 91-year-old grandmother, if I believe, or no, his mother, I'm sorry, his 91-year-old mother down in the Carolinas, and I called him back from that time with his mom, and he hasn't left since that time. He's been here every day fighting the coronavirus here in the state of Missouri, and I thank you for that, Doctor. I thank you for staying the course on that. So with that, Kelly, let's answer a few questions.
All right, Governor, thank you. The first question is from Summer Ballantyne, Associated Press. Taking to Twitter on Monday, President Trump said some are, quote, saying that it is the governor's decision to open up the states, not that of the President of the United States and the federal government. Let it be fully understood that this is incorrect. It is a decision of the President and for many good reasons. Governor, who has the authority to ease social distancing restrictions currently in place in Missouri? And are you coordinating with the White House?
Yeah, well, first, let me clear this up. I don't know what the President tweeted and what he didn't tweet. But we've been talking to the White House weekly. Matter of fact, I was just on the phone with the Vice President just a couple hours before this briefing. One of the things, the President well knows what the authorities of the states are and what the governors are and what the President of the United States are. I think he, like all of us, are anxious to get the economy getting back on its feet, moving forward, and I think that's what he cares about when he says things like that. But he's well aware to know the difference, what the President of the United States duties are and what the governors of the United States are. So I'm not worried about that. The President's going to work with us governors. He's proven that time and time again.
All right, thank you, Governor. This question is from Jason Hancock, Kansas City Star. Governor Parson, today Kansas City Mayor Quinton Lucas said discussions are underway about extending stay-at-home orders in the Kansas City metro that are set to expire on April 24th. Have you been a part of these conversations, and would you support extensions of the local orders, or are you considering extension of your own statewide order?
Yeah, let me just say this. We're in constant communication with the mayors every week. A lot of the major mayors around the state, we talk to them, trying to figure out how do we work better together on a coordinated effort for the state of Missouri. I think we're all looking for the date when we can hopefully free up the economy a little bit. But each day changes, and we have to make sure we're at that point before we open the entire economy up again in the state of Missouri. But I talk to Mayor Lucas every week we do on that. So I think the communication's there, but yes, we are having those discussions about how we might extend that, what that extension might look like. But again, that'll be a decision made in a few more days, I would say.
All right, so kind of a follow-up question from that one is from Jeff Bernthal, Nexstar. What factors will determine whether the stay-at-home order set to expire April 24th will be lifted or extended? Yeah,
I think I talk about it all the time. Daily data that comes into this governor's office from around the state of Missouri. How many people are in ICU beds? How many ventilators are out there? Are we gaining on the number of people going into ICU beds? Are we controlling the virus? All of those things have to be looked at on a daily basis. And then we try to find out where is that comfort level going to be when we feel like we can start opening up the economy. We're all going to be anxious to do that, and I realize that, but we really have to be patient for a little while longer to make sure that we've got this virus under control as much as we can have it under control.
All right, thank you, Governor. This question is from Rudy Keller, the Columbia Daily Tribune. Governor, the daily revenue report for Friday shows that in the first 10 days of April, sales tax receipts are down 18.5%, and individual income tax receipts are down almost 20%. Legislative budget leaders say they need to develop a consensus revenue estimate for the coming year and would like that done by May 1st. How are revenues looking for the coming year, and do you think that is a reasonable date to know what resources the state has and how federal aid can be used?
Yeah, I'm not sure what that date's going to be. I don't know that anybody knows for sure when this is all going to come about. We know the economy is going to be extremely affected by that. And when you look at those numbers, they speak for themselves. We're going to have to make a lot of adjustments in 2021. But that's going to be a work in progress, too. I think, I'm not sure you're setting deadlines on that, and I'm not for sure where we're at in the economy yet. Again, we're looking at unemployment numbers every day. We're looking at those tax revenues, and we're looking at how quick we can get people back in the workforce. A lot of factors come into that. So I'm not sure there's any magic date out there how it's all going to be done. I think we all know the challenges we're facing, and I guarantee you between the legislatures and this office, we're going to figure out a solution to the 2021 budget.
All right, thank you. Governor, this question is from Heidi Schmitz, Kansas City, Fox 4, Kansas City. The Kansas City Organized Grocery Store Workers is asking for Governor Parson to order grocery store customers to wear masks while shopping. The governor declined an earlier request. Are you consider reversing that decision?
I have not. I'm not going to mandate whether people wear a mask or not. I think that's up to the individuals. I think that's up to the companies that the employee works for. If they want to require that, they're business people. They can require that to customers if they so like. But I don't think that's a position the governor should take to mandate people to do that. At this point, I don't believe it's the right decision to make.
All right, and a follow-up question for Heidi. The union is also asking for grocery store workers to be declared, quote, first responder workers, so they're eligible for free emergency child care and other benefits. Do you, Governor, have any comment on this issue?
Yeah, look, I wish there was more we could do for everybody that's out there on the front line every day, but whether it's the person working in the grocery store or the pharmacy or the convenience store or any other facilities that are out there that, quote, essential businesses are working out there, they're all in the same category. And at the end of the day, I just cannot make everybody first responder to that, and I'm not going to be able to do that at this time.
All right, Governor. Caitlin Schallhorn from Missouri Times. Are Missouri wastewater treatment facilities testing or sampling for COVID-19 at this time?
My first answer to that is I'm not for sure, but the thing I would do is be able to contact DNR to see if that is taking place. They very well could be, or I'm just not for sure at the time. It's something we'd refer that to the DNR and let them answer that question for them.
Okay, thank you. And the final question for you, Governor Parson, is from John O'Sullivan, KMOV. The governor has stated the state is doing its own projection and not relying on outside modeling, but some of those outside models are State Missouri has enough hospital beds and ICU beds, but will need more ventilators. Do you believe we have enough hospital capacity at this time, and do we have enough ventilators?
I most certainly do believe we have enough hospital beds at this time. I think the Missouri Hospital Association would tell you that. We track them every day. I think we're in good shape on ventilators in this state under the current conditions, and I think those current conditions are getting a little better every day. So I think I'm very comfortable right now with the beds we have in here, with what the hospitals are doing, and frankly with what we just done by opening up more bed facilities there. But Missouri's in good shape. It's in a lot better shape than a lot of those states out there when it comes to being prepared on the ventilator situation and the ICU beds.
All right, thank you. These next few questions are for Dr. Williams. Dr. Williams, John O'Sullivan from KMOV has a question for you as well. Today, St. Louis County Executive Dr. Sam Page said the county had made a multi-million-dollar purchase of COVID-19 tests that expects to be delivered in coming weeks. Does the state not have enough tests that it can pass on to the local governments?
Thank you for the question, Donald. And we have done 45,000 tests between our commercial and academic labs in Missouri. Of the 37 states that have over 1.5 million people, kind of the states that we compare ourselves with, we're 15th for the most per capita testing. So we are doing robust testing here in Missouri. However, as the governor has said, we could always use more testing. And so we've worked very closely with Sam and Spring and Emily in St. Louis County. We have sent them tests. And we think that's so fundamental to what we're doing, both in this acute phase and also as we hopefully move toward recovery. And so we certainly support Sam doing that if he thinks that's helpful. But we have commercial tests, and we're doing have the capacity to do about 5,000 a day anywhere in Missouri at any given time.
All right, thank you. This is from Ethan Stein from KOMU 8. Local health directors have called the state's action regarding funding at the local levels, quote, a slap in the face. Another city manager accused your department of hijacking funds. Why would people say that about you and your department?
Well, thank you for the question, so I can clarify that. This is the month we celebrate public health, and I've been involved in this for 35 years now. So these are my friends and colleagues, and can't thank them enough for what they're doing. I'll just add parenthetically that right now, if you look at our new cases, what we all hope for and pray for is what we call a hockey stick, that it starts curving this way. So we're all Blues fans right now. And over the last 5 days, that stick is turning a little bit and in the rate of new cases. And we thank our local health department so much for that. The original funds that we got, frankly, we just thought that we had to push those forward to saving lives, mostly to go to PPE. We knew the first responders needed those. So that initial tranche, we dedicated that. But as Herb said and others have said, we have other money coming here, and it's fully our intent. And I've talked with them. I talked with them all weekend. I talk with them daily. They fully understand after that initial letter that is clearly our intent. So I just want to add also, though, as much as I appreciate our health departments and all the people who work at the Department of Health and Senior Services and Public Health, this is not the time to let up. You don't pull the goalie when you're doing well, and you don't take Patrick Mahomes out. And if you're a Cardinals or Royals fan, you don't pull your pitcher if they're pitching scoreless innings. So this is not the time, even though we're seeing a good trend, this is not the time to let up. This is the time to continue to practice social distancing because we think it's working.
All right, Dr. Williams, this is from Philip Sitter, Jefferson City News Tribune. Last week, the first offender in the Missouri prison system confirmed to be infected with COVID-19 died after he had twice tested negative for the virus but remained hospitalized for other medical conditions. Does that case raise any concern for you about the reliability of testing, and how much do we know or not know about the specific causes of death among all those who have been infected with the virus and then later died?
Great question. Thank you for the chance as a physician to clarify the test. The CDC has not given us exact sensitivity or specificity, but we think it's around 98% for both of those. So the test is accurate. But you may have seen media reports. The test is very dependent on how you collect it. You have to collect it in the proper medium, and you have to get a correct sample. So if you do that, we think the test is very sensitive, but it is a difficult test. They say that you should do the swab until it hurts, and obviously as a physician, people don't like to do that. But when you put it that far back in the turbinates, you have to get a good sample. And then the other thing is you're most symptomatic, you're most infectious when you're symptomatic. So if you test at other times, you're not going to get the same sensitivity as specificity. As far as the causes of mortality, we're re-looking at that. We do think that the vast majority of our cases are related to COVID-19, and they're associated, as we've said before, with hypertension, with lung disease, and diabetes, that they are a precipitating factor or a comorbidity.
All right, Dr. Williams, this is from Ashlyn O'Hara, the Columbia Missourian. Where did the state order 220 ventilators from, and did you ever receive them?
Ashland, we have not yet, and the Department of Office of Administration ordered those. We have 123 ventilators that we have in reserve that the state has always had, as Herb mentioned. And as the governor said, we watch daily the number of ventilators in Missouri that are being used, and I look at it every morning when I wake up. And we have about 21 ventilators among our 150 hospitals or so, and every day we're using about 1,000 of them, 1,100. So at this point, we're encouraged as we think about surge that at this point we are equipped, even in areas that have more concentration like St. Louis, to meet that surge capacity. But thanks for the question.
So has the state sent any state-owned ventilators to hospitals requesting them?
We have not yet, but we're fully prepared to do so. Hope for the best, prepare for the worst. And if Herb and our other hospitals think we need them, as he said, we have an agreement in place. They have a mutual aid agreement, and we have, through the funding he talked about for almost 20 years, a very baked-in plan on how to distribute those when they're needed.
All right, and the final question for you, Dr. Williams, is from Robert Cox, the Republic Monitor. The Perry County Health Department has a staff of 13, including 3 nurses who have been put in more than 300 hours of overtime, a situation that is mirrored in local health departments across the state. On Friday, Governor Parson said he believes some of the federal money Missouri would receive for its COVID-19 efforts would find its way to local health departments. Yet you indicated in an email on April 3rd that the federal grant money received by the state would be used solely by the state. Will local health departments see any additional funding from the state during this pandemic?
Robert, that is certainly our intention. We're waiting for the federal guidelines for that initial on how to distribute money, and then that always has to be decided how that is done. You have local municipalities, and then you have the health departments. But as I've said before, in this month that we celebrate public health and all those who've dedicated their lives to it and doing such a great job working with our hospitals, doing our mobile clinics, we certainly feel a strong, very strong commitment to support them at the local level. Thank you.
All right, thank you. I have one last question for Director Karsten. This is from Melissa Nelson, MissouriNet. Director Karsten, some states have reported receiving fake or deficient personal protective gear. Has Missouri run into this problem, and what measures do you have in place to ensure the state is receiving adequate equipment and working with reputable middlemen and suppliers?
Well, thank you for the question, and from my remarks earlier, obviously the answer is yes. Missouri has now received at least some equipment that did not meet the standards that we had specified when we ordered. So what measures we have in place, we, of course, have been in the PPE procurement process for over a month and a half now. We put out the specifications for the vendors, and we also check references, and we ask for samples, and in some cases where samples cannot be provided, we ask for photographs of the product that is to be produced. Now, since our experience over the weekend, we are establishing a working group to look into this more closely. That working group will be comprised of experts on PPE from the DHSS as well as DPS and SEMA in looking at this, and we will invite the Attorney General's office to assist us in this review, and we will also include our procurement specialist from the Office of Administration. So I just want to add that this situation has been evolving and ever-changing. You know, we first started ordering, we would order the products and take delivery whenever those were anticipated. Next, the orders were made and we were asked for deposits before the orders would be processed. And so it's an ever-changing situation, and I would imagine after our working group has a chance to review it, we'll have some other steps that we include in the process. So thank you.
Thank you again to all Missourians for your efforts and cooperation during this difficult time. I know this Easter weekend looked different for most of us, but we greatly appreciate everyone's commitment to following the stay-at-home Missouri order. These efforts are working, and we must keep them up. Our actions today will determine where we are weeks from now. So please continue to be smart, be responsible, and stay at home, Missouri. Thank you, and God bless.